Hello and welcome. Thank you for joining us today. My name is Mike Whitmer. Before we get started with our webinar today, I do have a few housekeeping items I'd like to review as usual. All listeners are on mute. If you do have a question that you would like to ask, please use the chat feature of the webinar menu. Today's webinar is live and being recorded. The recording will be emailed to registered attendees following the program. We'll also post the recording in the resources section of ncmic.com. It does take a bit of time to process the recording and get it posted out there, so please be patient with us as we work through that process. I also wanted to tell you all about our next webinar coming up on February 15th at 2 p.m. Central Time. I hope that you'll be able to join us for that, but remember, the webinar will be recorded and posted on our resources page if you can't join us on the 15th. So now for today's program. Let me introduce our guest, Dr. Liz Moos. And I am going to turn off the PowerPoint slides because we have her live on camera with us. And that's much better. Dr. Moos graduated from Northwestern Health Sciences University in 2014. Following her graduation, she became Northwestern's first Human Performance Fellow, during which she earned her MS in Exercise Science from Concordia University, St. Paul. She also had the opportunity to work with athletes of all different ages and abilities, ranging from high school to Olympic and professional athletes. In 2018, Liz moved to California, where she has served on faculty at Palmer College of Chiropractic West and works as part of an integrative team at Crossover Health. Dr. Liz's sports training includes holding the ICSC and the DACBSP, and she has been active with ACA, SACA Advisory Board, and the ACA Sports Council Executive Team. Dr. Liz Moos, thank you for joining us today. So glad that you can be with us.
Thank you guys for having me. I'm super excited to be here.
So let's go ahead and dig in. You know, Dr. Moos, I've worked for NCMIC for a really long time, and I've seen some claims related to doctors treating athletes. So I tend to live in the world of worst case scenarios because that's the world I live in. As a sports doc, how do you plan for the worst case scenario?
Well, Mike, I think I live in that world with you too. So I like to plan for the worst and hope for the best. And so there's a couple of different things. So I think the first is making sure you're doing some training. So if you're not super comfortable, leaving your office and doing, I'm going to say like maybe non-traditional chiropractic work, there are a lot of really great resources out there, ranging from continuing education credits with, especially at the universities that do the CCSP training. I've known chiropractors that have gone out and done additional training with like getting an EMT or something, an athletic training certification. So it would say at first, if you're not super comfortable, go out and get some additional training. There's lots of options out there. And then for those of us that are quite comfortable kind of stepping outside the office and working in those non-traditional routes, I think it's really important to have a plan. And so when I was at Northwestern, being the first meant that I got to do some unique things, which included helping write some of the risk management plans. And so, for every place that we went, so we had a plan for like, well, what happens if we're at this practice facility? What happens when we're at this, this field, or anytime we were away from the clinic, we had a plan, from everything from like knowing where the AEDs are located, are we bringing AEDs and oxygen with us? Who's going to be the person to call 911 if we need it? You never want any of these things to happen, but you have to plan as if they're going to happen every single time. And so, an example of this is, we worked with a couple of different high schools, and unfortunately, this is a real example. And so we were working at this high school. I had a good team of, chiropractic interns, several of them that had just completed their EMT training. But before every single football game, we would go chat with the coaches, kind of talk about like, okay, so what's the plan? Who's got what, and sometimes it's even things like maybe not even related to the immediate part of the emergency, but it's like, who's going to manage the crowd to make sure that they're not coming and interrupting? Who's going to make sure the gate is open for the ambulance if we need to? Talking to the refs about like, well, what's the plan if something were to happen? And then also the other teams, coaching staff. So do you have your own provider? If your provider needs assistance, how are they going to let me know? Do you want to assistance, or does that come with some additional risk that you're not willing to take on? All of those little questions you have to answer before you get there. And then more importantly, you have to practice it with your team so that everybody on the team feels pretty comfortable. I told you I would give a real example. So this team we had worked with for a while, we had an incident where we ended up having to backboard one of our athletes. And the only thing that didn't go like perfectly according to plan was that it took the ambulance a little bit longer than we were anticipating for them to get there. But truly, it was as smooth as possible. And I think that the only reason why that happened was because we had every step of the process pre-planned out before it even happened.
And everybody knew their roles and responsibilities. So I would imagine training is a big part of that process.
Absolutely. Absolutely.
Yeah. I want to back up just a minute. You were talking about, getting additional education in this area of sports chiropractic. And when I did your introduction, I was kind of met with a bit of alphabet soup. And, we have all these acronyms in chiropractic and in healthcare. And then the sports world has some specific ones. Your bio says that you hold the ICSC and the DACBSP. What are those, and are there some other ones that docs should be aware of if they're interested in this?
That's a great question. So the CCSP, so the Certified Chiropractic Sports Practitioner or Physician, depending on the state, is the first kind of level of the sports credential. And I really like those. I think they're really great for any US doctor because they have an emergency training procedures course embedded within it. So after you've gone through the CCSP, the next level up would be the diplomate in sports chiropractic. And again, there's additional training in that emergency procedures. And in addition, you have several trauma-based practicals you have to kind of perform in a certain amount of time. And so you really, like, for those holding the diplomate, I feel like they've had a lot of training. They've had to go through, they've been tested on whether or not they're ready to take on, those emergency type of procedures.
Yeah.
The international certification, that is because in the US, like, the world is not the US. And so even though we've got some really great training here in the United States, when we go to international events, they have a minimum level of credential. And so in the United States, we have advanced standing, and I believe we have to take this changes a lot. So from the last time that I knew, you had to take a head trauma course every 2 years. And I believe a test, or so if I hold the CCSP, I have to take a head trauma course and then possibly an upper extremity course or an extremity course. I'm not 100% on that one.
Sure.
And then the head trauma has to be recertified every 2 years.
Okay, good. Yeah, and I think that I misspoke when in your introduction, one of your designations, I think I said ICSC and it's CCSC, correct?
Oh, no, you spoke correctly. So
I
the
did.
CCSP,
Okay.
yep. So the ICSC is, I think it is the International
Okay, gotcha.
Chiropractic Sports.
Okay.
I don't know. Something.
Yeah,
It
see,
stands
that's
for
the
something
alphabet
international.
soup. That's the alphabet soup, and and it is confusing. That's why I like to. There are lots of resources out on the web too. That docs can go out and find more information on educational opportunities if they're interested in this area. But let's move on and talk about another topic that we frequently deal with when we're talking with doctors that are involved with athletes and teams, and that's traveling with an athlete or a team to a sporting event. It's not as simple as just getting on the bus and going, right? Help us understand some of the issues around traveling with and treating athletes across state lines. You mentioned international a little bit too. So, what are some issues there?
Yeah. So, and please jump in and correct me if I say anything that is outside of your understanding. But when I was reading through the law this morning, again, just to make sure, From my understanding, if you are working with a team, so I am that team chiropractor, as soon as that team crosses state lines, I can still work with my team under the scope in the state that I'm licensed in. And that my malpractice insurance would cover me working to that scope on those specific athletes. What it One of the challenges with traveling with a team, and this was a law that came into was passed after I'd completed my residency. So when my teams or my fellowship, when my teams traveled, I would have to reach out to that board, and every state has different rules, to see if I could get a temporary license to be able to practice in that law or in that state to their scope of practice.
Mm-hmm.
So I think the most important thing to kind of know about is it has to be a team that you're already affiliated with. So through the, ACBSP, which is the credentialing body for those the alphabet soup you mentioned about me, sometimes they'll have opportunities to go to another state and work with, let's say, I don't know, USA snowball throwing, not a real sport, but
But it should be.
So if I were to just kind of show up and be a chiropractor at the USA snowball throwing championship, I would have to apply for a temporary license or hold a license in that state, and then also let my malpractice carrier know that I'm going to be doing this and get the approval from them. Sometimes they have the event might kind of cover you under their umbrella policy, but I think it's always a good idea just to make sure that your bases are covered. I'm a very defensive provider. I like to make sure that I'm protected, my patients are protected. So really, if I'm working with a team, I can travel with them to my state scope.
Yep.
and only treat those athletes.
Yeah. One thing that I want to go back to, you said that you call your malpractice insurance carrier, let them know. Great idea. That's not something that we require, but it's a really good idea, because then you call up your malpractice insurer, tell them you're going to be working this event at this particular place. We will note that on the file. But it gives the person that the doctor is talking to, the person at the insurance company, the opportunity to give them any information that they may need to know to make sure that their coverage will follow them. So I always encourage docs, call early, call often. We would rather talk to you and make sure that you've got the proper coverage in place and manage that risk than not hear from the doctor. So thanks for bringing that up.
Absolutely. I learned that from Chiropractical podcast. So Thank you.
Concussions. Let's shift gears a little bit and talk. They've been in the news. We've heard a lot about that. There's been a lot of scrutiny, about the decision-making process for returning athletes to play. What's the role of chiropractors in return to play decisions, and what factors need to be considered there?
So the first and most important is that chiropractors are not allowed to treat concussion in every single state. So please check with your state board on whether or not you are covered in that. And then, once if you're able to work with concussed athletes, I think the most important thing is that I'm going to kind of lean on the Minnesota state law, because that was what I was most familiar with. And that was when I was working with like high school athletes. So the law here was that anything that looked like an incident that could cause a concussion, I needed to remove that athlete from play and evaluate them. And I think that is just good practice anyways. So if there's something that looks odd, take the athlete out and evaluate them. Towards the end of last year, we got the most recent concussions consensus statement. And in the new SCAT 6, it specifically says that a thorough exam should not be any faster than 10 minutes. And so for, make sure you're trained up on how to perform the scat. If you're not, they have the British Journal of Sports Medicine, you like literally spells it out. I recommend practicing that as well.
Yeah.
And so, it was pretty easy for me when I was working with high school athletes, because again, the law was if they have any symptoms, if they had an incident, they're just removed from play for the rest of the day. That doesn't mean that it's easy though.
Right. And I kind of wanted to go there, because I have heard doctors say, that when they're, involved in return to play decisions, they can get pressure, a lot of pressure from coaching staff, from parents. How do have you ever experienced that, first of all? And how should doctors deal with that?
Yeah, I mean, I've been yelled at on the
Mm,
sideline. I've been yelled at on the sideline. I've been yelled at in the athletic training room. And so usually how I handle it and how I just try to remind myself my job is to protect the athlete.
right.
And sometimes that's not easy. And, and like I said, I'm always kind of thinking about how can I protect my athlete? How can I protect myself? I also don't want something to happen if I were to let this athlete go back in.
Right.
And so, depending on how young they are, like if they're in the high school age, I'm pretty confident in my abilities to say like, hey, this sucks really bad. Like this is really hard that I'm taking you out. But my job is not to think about teenage version of you. My job is to think about what is your health going to look like when you're 20, 30, 50, 60, 70? How can I protect that version of you? It doesn't always go over well. So I try to just kind of meet the athlete with empathy, because I was an athlete. I've been there.
Mm-hmm.
I've sat out of games that I didn't want to sit out of. And it can be really hard. And so I just try to meet them with empathy and, hold my ground.
Yep.
At the higher levels, there definitely is, there can be a lot of pressure. I don't work with an NFL team or anything like that, but that's a lot of money to take an athlete out. And, there's independent reviewers and all, and like coaching staff, like there's a lot of pressure. So I have a lot of respect for those people making those decisions. But at the end of the day, your job is to protect the athlete,
Yep.
not the investment.
Like so many other things in practice, the patient comes first. That's your doctor's top responsibility. Do what's in the best interest of the patient, and sometimes it's hard for them to see that that's in their best interest not to go back into the game. So I would imagine that could be a very difficult situation. So,
Yeah.
so let's shift gears a little bit. And while we're talking, you brought up high school and student athletes. Let's talk about a service that many chiropractors do provide in their communities, and that's pre-participation physicals. So first of all, what is a pre-participation physical, and what's the goal here?
Yeah, great question. So yet again, I'm going to say check with your state board to see if it's in your scope of practice. It has been in my scope of practice in previous states where I've worked. It is not currently in my scope of practice in California. But this is an examination that is looking at the athlete to see if there's anything that would maybe disqualify them from sport. And sometimes it's not a full disqualification, but maybe it is. An example is if I am legally blind in one eye and I can see well in the other eye, I can't play some sports that would put my good eye at risk. So there might be just like a list of sports that I am approved for. And so this is an exam that chiropractors, I think, are well poised to take on. Oftentimes the state high school league is going to give you this sheet of paper, and you go through and you go, eyes, great, check. Ears, great, check. Heart, great. And so the paperwork side of the things that we report back to the high school league, that is, I have seen, and I have been encouraged by some places to like, oh, that's just your documentation. But like I just said, it's like, do you have eyes? Yes. And that we are doing much more thorough exams. So what I did and what I do when I do these type of exams is I went back through my notes also I teach these classes at Palmer West. So like I, was saying like I am listening, or a heart auscultation. Like what did I like, normal, abnormal? If it was abnormal, what did I hear? Um, you know, you're going through each one of those systems and saying specifically what you did. I'd also like to add, I think in this day and age, there's a lot of, additional things that are not just like, that we have to be careful with, like, our palpatory,
Mhm.
like it might be totally normal. Um, but I make sure that I'm getting informed consent with my athlete, the parents, before I'm doing something like maybe I have to do a hernia check. And that's in a sensitive region. And I'm, very specific in saying like, explain the procedure to the patient. The patient gave verbal consent. I also told them that, if at any point they felt uncomfortable to say stop and my hands would come off. And I make sure I document all of those additional things so that nobody could even misinterpret a very normal exam as something that might be more nefarious. So just making sure that you're going through and documenting each one of those pieces. Not everybody maybe practices in their ophthalmoscopic skills every day. So if it is something that you're looking to add to your practice, maybe even just starting by, listening to, heart and lungs of your family members, just to,
Mhm.
we know what normal sounds like. It's just to kind of build that confidence in. And if you do find something that's abnormal, you just refer off to a specialist and let them be the one to make that final call.
Yeah. One thing I want to go back and pick up on, you talked about consent. Particularly with student athletes, if they're not college, they're going to be minors. So, what rules of consent do we follow? Is this parental consent? Can the student, if you are working with them and you say, okay, this is a different situation, we need to do this, can the student consent, or do you need to go to the parents? How do we make sure that we're doing that correctly?
That's a great question. And I don't know that I have the best answer, but I will tell you what my instinct is.
Sure.
And my instinct is that, like, before doing these physicals, you have to get parental consent to treat anyways. So maybe even just telling them, like, hey, these are the procedures that will be coming, and letting the parent have informed consent kind of
Mhm.
in that moment. There becomes kind of this gray line, especially like with teenage athletes. They may not want their parent in the treatment room. Um, but whenever you're working with kids, and anybody underneath the age of 18 is a kid, I think it's really important. Um, Unless you think there's abuse coming from the parent, to
Mhm.
like make sure the parent is involved and then also informed with what you're doing. Um, the world can be a really scary place, and just
Right.
making sure that everybody knows that you're being safe and that the child is being safe.
Yeah. 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 There, this isn't specific to sports chiropractic. I think this healthcare in general, consent issues around minors, and when there are divorced parents, and when, all these different things that come into play. And it's something that, every situation has the potential to be unique. So doctors really need to understand, what can they and what can't they do with respect to consent. So working through that, I would imagine that, in the case where, there may be suspected abuse or something like that, collaboration with coaching staff.
Yeah, absolutely.
Okay.
And
Yeah.
I'm going to say that at this point, this is probably where I would also be reaching out to Dr. Jenny Brocker, who I know has been on webinars and
Mm-hmm.
whatnot, because she is typically my go-to expert with, all things consent relating to different parents that are in
Yep.
divorce situations, to asking her what resources might be out there.
Absolutely. Yep, absolutely. And that's a great point. One of the many benefits of having your professional network, so that you
Absolutely.
got people with other areas of expertise, you can go to them. That's awesome. So I've heard of chiropractors working with athletic events and being named medical director. What does that mean? What responsibilities are you taking on when you accept that title of medical director?
From my understanding, I mean, one, it's really great to hear and that chiropractors are being asked to step up to these high level roles. When I hear medical director, I hear, top person in charge of medicine period, not chiropractic. And so when I hear medical director, I believe that, they're the one overseeing things like, okay, what is our plan for if there's, a cardiac emergency,
Mhm.
or, a respiratory emergency. And maybe, I think, every situation is a little bit different. So if I'm running, the 5K, or I have the 5K that is at my local town days, maybe I'm the one in charge of, also making sure EMTs are there. And maybe I'm, hiring, or, getting volunteer nursing staff in case there's any, heat related or cold related illness. So I'm the one kind of overseeing that, and making sure that those things are in place. Um, I think that sometimes we get really excited about our ability to hold that role. And, chiropractors are highly trained. We can fill these roles,
Absolutely.
but we're not always prepared for them.
Mm.
And so, if we go in there thinking like a chiropractor, and we're like, oh yeah, there's going to be these few things, like we might be setting ourselves up for risks. So I think when we're thinking the term medical director, we're thinking all the possible medicine related things that could go wrong, and do we have a plan? And if it's in my scope of practice, am I prepared to take on that? And if it's not in my scope of practice, do I have somebody on my team who is able to take on that
Mhm.
role?
Yeah. Okay. Thank you. Uh, one more question, and then we'll see if we've got any questions from listeners. Um, everyone who knows me, everyone who's listened to our webinars, our podcast, they know that my mantra is document, 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 mainly because documentation plays such an important role in risk management and the defense of doctors if we're involved in malpractice litigation. The documentation is the front line of defense. So what are common standards and challenges with respect to record keeping when you're working with athletes? And I would think that this would be a particular challenge when we're traveling with an athlete or with a team. What recommendations are there? Anything special that our listeners should know about this?
That's a great question. I also believe document, document, document. I think my students are sick and tired of me, saying that to them as well. So just like you said, our biggest defense is what we write down. And so, like I said, I write down, when I get verbal consent from even just palpating very normal structures. And so, yeah, I don't want to say I'm an over documenter, but I document everything. And so, absolutely. And then if you're doing any special procedures, like I said, like even if I'm doing a heart and lung exam on my patient because they said they have whatever when they're running, I'm going to make sure like I fully explain, like, hey, I did this. This is how I draped them. They gave me consent to palpate around their chest. This is what I heard. This is what I did with the recommendations. And that's kind of like all within the office. Now, when I'm outside of the office, my documentation does not stop. So some of us might have, electronic health records that can kind of travel with us. So maybe I'm, writing down them on my iPad, on whatever platform I use. But when we're at Palmer West, we do an informed consent for soft tissue therapy, for taping, for any adjusting we might be doing. And there's a whole process. Literally, if I give out a band-aid, I'm documenting it.
Mm, yeah.
And so, yeah, it's really, really important just to kind of keep those strong documentation standards, um, throughout, in the office and outside of the office. And maybe it's, I have, my list of athletes that I'm always treating, and, I've gotten their permission, and like I'm just writing some quick notes to myself so that after the game, because I also don't want to like turn my attention away from, something that I'm supposed to be watching.
Right.
But maybe, writing some quick notes, and then it might be a little bit of time after the event where I'm like going through and kind of confirming like, oh, yep, here's everything that I did, just to make sure that I have that record even on the sideline.
Yeah. Okay.
At the races, because they're athletes that I'm not familiar with, we do go through a pretty, all the red flag questions. If anything is like even a maybe, we make them kind of ask some extra questions. It might be like sometimes our patients misread the like worst headache of your life question.
Mm,
And we'll mark yes. And in my chiropractic brain, I'm like, oh no, this is scary.
right.
And then I have to like calm down for a second and walk over and be like, okay, well, tell me more about this worst headache of your life. It might just be like, oh yeah, I had a migraine for the first time last week and it's gone now. Well, ask all those additional questions, and then I have my patient like initial next to it, since I'm now overriding their initial like answer of like, yes, this is the worst headache of my life. And in those cases, that's when I'm going to write my whole note, because I'm a lot less likely to remember, based off of my quick notes, what
Yeah.
I did with somebody that I'm just meeting for this first time.
Okay. All right. Well, thank you. Very interesting discussion. We do have two questions that have come in. First one is, and I'm going to paraphrase this, if I'm understanding it correctly. Athletic events are out in the open. Everything's visible. Privacy, HIPAA. Any concerns there?
Oh, I love this question. Thank you, whoever gave it to me. So yes and no. And so that's and this is also to the best of my understanding. So if there is a place where I can take the athlete away to make it more private, and so for example, like in the case of concussion, all the extra stimulus of a game going on may not be the best place to take that athlete or to do that testing. So if I can move the athlete off to the side or anything like that, I'm going to do that. If I'm working with an athlete, especially a minor athlete, and I take them off to the side, wherever I am, it has to be easily interruptible. And because I tend to be very a defensive provider, I'm probably bringing a chaperone with me just to make sure that I have, additional eyes on the situation, so it can't be misconstrued what we're doing when we're taking an athlete away. But for some things, they know going into it, like if I have a big tent at a race and they walk through, they know that they're doing something. If I see something that's like kind of private, I might pull them off to the side so that they're not like announcing to the whole tent, like, hey, I'm just recovering from cancer or whatever it might be. Like we'll go and ask those questions off to the side. I think trying to make sure that your voice is a little bit, softer, so you're not advertising to the other end of the tent, like what this person has going on. Those things are all important. So
Sure.
did I answer the question?
Yeah, no, that's great.
Okay.
And I've got one more for you. So anything about marketing services as a sports chiropractor, putting that out into the community that, I am available to treat your team, your athlete, or maybe advertising pre-participation physicals or anything like that. Any caveats there, things that our docs should be aware of?
That's a good one. And my answer is going to kind of suck.
Okay. Fair
I've
enough.
never been it's been a long time since I've been in a private practice situation. So I am not the expert in marketing. I believe in some states you have to have the CCSP or the diplomate to call yourself a sports chiropractor. I'm not 100% on that answer though.
Okay.
But I would, aside from that, I would say, as long as you feel comfortable and competent in doing that, it's probably okay to say that I do treat sports injuries. Saying I treat sports injuries and saying I'm a sports chiropractor are two different things. Both things are good, but two different things.
Absolutely.
And so I think it's totally okay to say like I treat sports injuries and that type of thing. And then, just as long as you're prepared to take on what that means. So if you're not super confident in doing an abdominal exam, maybe don't say that you do pre-participation physicals right away. Or if you're not super competent in the scat right now, maybe give yourself some practice before you're advertising that, like, hey, I'm the concussion expert here.
Sure. And you brought it up when we were chatting about this before we went on the air. That so many of these rules vary from state to state. So, when in doubt, ask your board. Get in touch with your licensing board and ask the question. This is what I want to do for my advertising. Make sure that you're familiar with the rules around advertising in your state as a chiropractor, and there are just so many things in healthcare that are controlled at the state level that doctors just need to understand their state statutes. So
Absolutely. And then I'll add that, your state organization, whatever it might be, will
great
also
point.
probably have a lot of good resources for you. I like to go to the state board first because they're the law.
Yep.
And sometimes their answer is going to be maybe a little bit more thorough, but like after that, your state board or your state chiropractic organization will have some, additional resources to probably kind of branch the law to practice.
Yep, that's a great point. The associations are such a vital resource for the entire profession. So that's a great place to turn. So, well, Dr. Liz, I think that we'll go ahead and stop there. Thank you so much for joining us today. This has been a really fun conversation. I've enjoyed it. I've enjoyed seeing you. Enjoy the weather up where you are. I hope it warms up a little bit this weekend. Before we go to our listeners, I'd like to remind you of our resources section on ncmic.com. This webinar will be posted there as soon as the recording's processed. So we're continually adding to our content with information to help you navigate daily practice and deal with challenges that you face. We have information out there on a wide variety of topics that doctors face in daily practice, so please check that out. You can also keep up to date on new resources from NCMIC by following us on social media on Facebook, LinkedIn, and Instagram. One last reminder, our next webinar is scheduled for Thursday, February 15th, 2 p.m. Central Time. I hope that you'll be able to join us, but if you're not able to, we will record that one as well. Until then, thank you for listening and talk soon.
Thank you.